Palpitations could be a sign of many types of cardiac disease. Palpitations are literally an awareness of the heartbeat. Different patients describe it differently. Some describe it as skipping or fluttering, missing a beat. It can be associated with problems in the heart, and it can be associated with problems outside the heart. So things that can be associated within the heart are problems where the heart does not pump correctly, such as heart failure, problems with the heart valves, or this could be a primary electrical problem and a heart rhythm problem. Outside the heart, this could be a marker of overactive thyroid, anemia. There may be many other causes that affect the patient, but what it calls for is specialist assessment and investigation. So I think if the patient was to run into palpitations and was to black out or lose consciousness, then this is quite worrying from our point of view in cardiology. And this means that the patient should seek emergency medical attention and of course be met with a cardiologist within the hospital. In terms of other concerning features, if the palpitations are linked with worsening shortness of breath, swelling of the legs or ankles, increased breathlessness at nighttime, recurrent dizziness or giddiness, or indeed blackouts, then this all increases the index of suspicion and the need again for specialist assessment and investigation. So there's a range of classifications for palpitations, but simply stated, I would say that there are benign and complex. And benign palpitations, we never dispute what the patient reports to ourselves as healthcare providers. But the issue being is after assessment and investigation that the patient's palpitations equate to minor electrical abnormalities, such as an ectopic beat, which is an extra heartbeat, which we all suffer from, but the patient may be more attuned to. This is differentiated after investigation to those with complex palpitations, whereby the patient has other issues with the heart, such as the heart pump is not working well, the rhythm is a serious rhythm disorder, or there are problems with the heart valves. And these may go as a solitary problem or as a combination with other aspects of cardiology. So this is the need for the process. In terms of treatment, the treatment within cardiology is tailored towards the cause and the association of the palpitations and may call for specialist medication, even specialist procedures, and there are varying types. So the main causes of palpitations in terms of triggers, there are a range of potential triggers that include things that we encounter in our day-to-day life, such as stress. I know this is an overused word, perhaps sometimes in modern day life. Alcohol, particularly in excess, caffeine. We all are particular to a cup of coffee, but excess caffeine in our diet may cause this. Beyond the lifestyle factors, there are other potential aspects which trigger the patient, which include thyroid disease, a lack of red blood cells or anemia, and an association with different forms of cardiac disease. So the first thing that I always do with patients with palpitations is to ensure that we have a thorough history and examination of the situation. And the first thing is to review the patient's lifestyle and make sure all the lifestyle factors have been modified successfully. And then beyond that, there is the need for that specialist assessment and investigation. And then it may call for specialist medication, including there are a range of potential classes, but beta blockers, calcium channel blockers, and other rhythm-based drugs. If we have found other problems allied to cardiology, then there may be the role for specialist medication for those reasons. Specialist treatments allied to heart rhythm problems or allied to structural problems. And then the other potential option is electric shock treatment, which may help restore the patient back to regularity if that is indicated and indeed needed.